menopause has always been taboo. It's not talked about. It's swept under the carpet. Our mothers didn't talk about it. Suck it up and get on with it. It's what happens. There are doctors that still have that same mentality. But the reason why I'm so glad that we're now talking about it openly is that people's experience of the menopause is very, very different. Glycan production. It controls the melanocyte. It controls the blood vessels, the angioblasts that create blood vessels, right? It controls ceramide production in the epidermis. It controls everything. And so what happens as we become menopausal is we lose barrier integrity. Barrier function is affected. So women tend to find that their skin becomes more reactive. You've never had a case of reactivity or sensitivity or rosacea. Everything happens. And you've got...
So it's changing the way that we actually look at the skin.
Yes.
And there's going to be a protocol change.
Yes. I tell from the quality of their skin. And I say, I'm actually a menopause coach. No. Oh my God, I was meant to have you. I was meant to have you. And then you can't shut them up. And this is why I am passionate about this. It was almost like when I did my nutritional medicine and I learned about gut health and I had to do the course on gut health because it was like therapists need to know this.
I can get through this.
Beck,
sleep at night. Like just because, as you know, when we spoke about it, when I did the run, I actually went into menopause. Must have been like it was. Well, it happened before because I had so much stress on my body.
Yeah.
So when I stopped my periods. And I haven't had a period since. And the night flushes, the not sleeping, the no libido, all the symptoms that you talked about, felt a bit like I couldn't focus on anything. Like you get a bit you're just a bit all over the shop. It's like you're nearly having an out of body experience sometimes. Like it's just the weirdest thing.
Typical signs, the lines, the wrinkles, but there's a dryness and a dehydration to the skin where they have not been in treatment before. You know those skins very dry and fragile. Like you said, so it's diet, it's lifestyle. A component that's very important is self-care. Self-care, non-negotiable. They're resentful, right? They're impatient.
Victim mentality.
Yes.
For me, because that's how I feel. Because
and no one understands them.
Giving to everybody. Like, they're worn out. This incredible lady does not need an introduction. Chiza Westcarr, an absolute legend, and has helped me so much in my business to understand the internal health of so many of the beautiful clients that we treated with skin. And you've helped me so much in my business. I'm forever grateful for that, Chiza. As a nutritional medicine practitioner and a dermal therapist, you've got so much wisdom, and I love your passion. Like there is nobody that I see that is as passionate as you, and I'm really excited about our conversation because it's all going to be about perimenopausal and menopausal. And when we think about it, for me, as a menopausal woman, as I said, I can't believe I'm even saying that, and grabbing you at a big conference earlier on this year just going, oh my gosh, I'm struggling. And, you know, if we think about it for our, you know, our salon and clinic owners, a lot of the skins that they're treating are perimenopausal or menopausal. And if we can get a deeper understanding of what's actually going on for the beautiful women that sit before us, and you know, the question that I really have to ask you is what led you here? And I know that, you know, gut health, you know, all the things that you're a researcher, you're an educator. What led you down this path?
I first of all want to say thank you for having me, Beck. You know I adore you, and it's always nice to catch up, and for you to be doing this for your community, I think it's fantastic because the time is now. We're now talking about what once was a very taboo topic very openly. And why I'm excited especially is because, like you say, I am hands-on. I'm a dermal clinician. I work in clinic with these same clients that your community work with. But I also, as a nutritional medicine practitioner, see these same women who notice that they're putting on weight, especially around their middle. So they come to see me in both respects, for the aging face, but also for the changes that they're noticing. And yes, I remember talking about gut health when it wasn't even a thing. I remember talking about the skin nutrition connection when it wasn't a thing. And like you say, I have been an educator for a very long time. So researching is what I do. And I just remember going back to when I used to be a trainer for a medical grade skincare distribution company. And I was with them for 11 years, heading up education. And we would go into clinics and do training and, showing the fantastic products that we had for clinic use at the time. And from one clinic to the next, we'd hear, oh, your products don't work. Oh my God, we love your products. And there'd be inconsistencies with the results that these clinics were achieving. And I knew that it had to be what was going on with the patient, stress levels, nutrition. There were considerations that had not really been looked at. Now, gut health, it's commonplace. Everyone knows that good skin starts in the gut.
Yeah.
Well, so with these same women who are coming in to see me for facials, I remember, this one time I went to turn on the steamer, but I always ask my clients whether they would like steam or not. So I asked her whether she would like steam, and she goes, oh, I couldn't think of anything worse, because she was menopausal and heat can set off a hot flush. Right. And so we don't think of these things because sometimes we're on autopilot. We know what we do and we do it very well. But this is the age where we can no longer do that. You've got to now deviate from what has been your hymn book, your hymn sheet that you've followed so religiously, because it doesn't work. We might as well crumple it up and throw it away. Because what happens with the decline in estrogen that happens before menopause, which is why I'm glad you mentioned perimenopause, because there was a study done 2 years ago called The State of Menopause. And it found that menopausal women in the study didn't even know that perimenopausal women, I beg your pardon, in the study did not even know that there was a phase before menopause until they were in it. So menopause has always been taboo. It's not talked about. It's swept under the carpet. Our mothers didn't talk about it. Suck it up and get on with it. It's what happens. There are doctors that still have that same mentality. But the reason why I'm so glad that we're now talking about it openly is that people's experience of the menopause is very, very different. There are women who suicide.
Yeah.
Suicidal ideation. If you haven't experienced that depth of depression, then you can't begin to understand. But because menopause is now being talked about, jump onto Instagram and watch women attack each other. And there are lots of fantastic doctors that are embracing this conversation too. So on their pages, you'll see lots of comments. You're medicalizing menopause. It's not as bad as you're saying. And then there are these other women saying, it saved my life going on HRT, which I also want to unpack. So as I'm having these women come to see me, both for skin, but also for health and wellness, I myself became menopausal. And I remember my sister saying to me, are you going to go on HRT? And I said, no, very emphatically, no. My sister was a menopause doctor in the UK. And she said, can I ask why not? And I said, oh, because I'm managing it fine with lifestyle and exercise. I'm fine. I had no hot flushes, no night sweats. And I wasn't experiencing a lot of what these women were experiencing because I too thought that menopause was really about hot flushes and night sweats. That's what I thought it was. And so I hadn't had them, so I'm fine. I've breezed through it. And she said to me, what about the risk of dementia? What about cardiovascular disease risk? The number one killer of menopausal women is cardiovascular disease, heart attack and stroke, number one. She said, what about insulin resistance, which happens with menopause without you doing anything, which means that you're now at risk of type 2 diabetes? What about osteoporosis? What about the atrophic vagina that we now know is not just the vaginal atrophy? It's now called the genitourinary syndrome of menopause because the pelvic floor supports the bladder, it supports the uterus, and it supports the anus. You can have prolapse of any of those three as estrogen declines. But when I heard that the brain makes testosterone, progesterone, and estrogen, so it's not just the ovaries, the brain does, I was shocked to learn that there is not one body system that is not influenced by estrogen. Every cell has a receptor for estrogen on it. And I'm saying this so that we all can appreciate the gravity of this conversation. So when we talk about perimenopausal women, they might think, oh, I'm not there yet. The conversation should start before perimenopause. So when we define perimenopause, it is the years that precede the cessation of your menstrual period. The day after your menstrual period, the day after your final period, you are considered postmenopausal. But nobody knows that was the last day. So we talk about it being a retrospective diagnosis, which means that we count back. It's got to be 12 months from your last period. Yep. That will then herald the fact that you are now menopausal or postmenopausal. Those 12 months have got to be consecutive months of no menstruation. When you're perimenopausal, your period starts and stops. It's heavy, it's light. You don't know what's happening. And you might have gone 8 or 9 months with no period and you think that, okay, I'm menopausal. Then it pops up again. You've got to then start from that day to count 12 months again. So it's 12 months no bleed. You're now menopausal, but really you're postmenopausal because menopause is just one day and it's the day of your last period. And then beyond that, you're now postmenopausal for the rest of your life. But in Australia, the average age is 51, but you can have it at 45. So 45 to 55, is usually where the curve tends to be. 51 on average, but anywhere up to 10 years before is when the changes start. And the changes in perimenopause or the years that lead up to menopause are exactly the same as what happens in menopause. The only difference is you're still having a period. But you still have the rage, you still have the moodiness, the low mood, the weight gain, the poor sleep, the fatigue, the drive, all of these things happen whether it's in perimenopause or menopause. I was having a joke with Beck before and I said, Beck, one thing that will fix a dry vagina is regular sex.
Sex, yes.
And if you're getting it regularly, then usually you're not in the camp of those that are saying that it's painful, it's uncomfortable, who then stop having sex. Just before I had a phone call from a woman who heard me on a podcast saying, oh my God, you were speaking to me. My vagina is so dry. Sex is so painful. My poor husband, she said. But honestly, this is why we need to talk about it, because this is why marriages dissolve. The woman has lost her libido. She's not interested. It's painful. She's tearing because estrogen. The reason why this is a conversation for us as clinicians, as therapists, is because 30% of collagen loss happens in the first 5 years of menopause. 10% of bone resorption happens in the first 5 years of menopause. So her facial structure changes. I mean, I've noticed it. I can't take photographs as well as I used to. Oh my gosh, I'm like, let me see that. No, delete. It's terrible. It is terrible. But what happens as we start to lose collagen is we get the hollowing out, right? Our skin starts to sag. All of this. And so who do people come to? Women come to? They come to skin clinics because that's what we specialize in. And if you don't have a doctor as part of your team, then you have someone that you refer them to. But it's a collaborative effort because estrogen controls collagen. It controls elastin. It controls glycosaminoglycan production. It controls the melanocyte. It controls the blood vessels, the angioblasts that create blood vessels, right? It controls ceramide production in the epidermis. It controls everything. And so what happens as we become menopausal is we lose barrier integrity. Barrier function is affected. So women tend to find that their skin becomes more reactive. You've never had a case of reactivity or sensitivity or rosacea. Everything happens in menopause. This is why it's important for us to know. But even more importantly, and this is the one thing that I'm passionate to try and get therapists to understand, is wound healing slows down because the signaling molecules, we talk about cell-to-cell communication, growth factor signaling slows down, right?
So it's changing the way that we actually look at the skin.
Yes.
And there's going to be a protocol change.
Yes, Beck.
Because it is actually, oh my goodness, that's amazing.
A protocol that is different to how we have always looked at skin. And this is why I'm trying to get the message out that estrogen deficient skin is what menopausal skin is. If the skin is estrogen deficient, read barrier impaired. Bang. Barrier impaired, meaning you can't look at those wrinkles and go, I'm going to hit the skin hard. Yeah, the deeper, the more effective. That's not it. But you also can't do treatments monthly in every case because it takes longer for the wound healing process to happen. Look at your granny when she cuts herself or when she has a fall. Look how long it takes for the bruise to clear or for the skin to heal. Look at a baby. They do surgery on babies inside the womb and there is no scarring. There's no scarring. When they're born, no scarring. If an infant injures themselves, it heals so quickly. In menopause, estrogen, which is anti-inflammatory, as it decreases, we have an increase in oxidative stress. We have an increase in inflammation. Menopausal women have chronic inflammation. And we haven't even started to talk about stress yet. We haven't even started to talk about diet yet. We haven't started talking about alcohol consumption yet. So can you see the picture of the patient or the client that walks into your clinic and all you're doing is putting Botox into her face?
Yeah.
Or all you're doing is doing a facial and you haven't asked her for a second how she's going. When I get my ladies and I ask them about steam and I'm getting them ready, I always put my hand on their shoulder and I say, how are you doing today? And the sigh that they let out. And then because I already know, I can tell that they're menopausal. I've had a look at their notes as well, right? But then I can tell from the quality of their skin. And I say, I'm actually a menopause coach. No. Oh my God, I was meant to have you. I was meant to have you. And then you can't shut them up. And this is why I am passionate about this. It was almost like when I did my nutritional medicine and I learned about gut health and I had to do the course on gut health because it was like therapists need to know this. You cannot be stingy with your knowledge. You can't hide and do your work because we will never run out of women. There are 1.1 billion women that will be going through menopause. The statistics were last year and were 2025 next year. Last year they had next year as the year when the world would have 1.1 billion women. Now when you look at the statistics, they say 2025, they say 2027. The fact is that there are more and more women moving into this life stage. And guess what? There is no consistency when it comes to how we can help her because nobody has been taught. Doctors, where they have been taught about menopause, might have got 4 hours. But some of them had no education on menopause. And this is the problem. It doesn't matter where she goes. So when I speak at these doctors' conferences, I remember last year and the year before when I was the only person at Cosmeticon and NSS at the dermatology conference at Cosmeticon, Cosmetex, all of these conferences, just me talking about the skin changes of menopause. And then this year at NSS, they actually had a panel of 5 doctors talking about menopause. So now we're starting to talk about it. But the reason why it's important, and as I say, as I stood up there, I said to these doctors, the menopausal woman is very much like an orphan because no specialty owns her. Where does she go? Psychology, dermatology, gynecology? Who owns her? And because no specialty has been set up for menopause, it means that she slips through the cracks. It means that she goes to a dermatologist and he says to her, no, don't go on HRT, it's going to cause breast cancer. Oh, you've been on it for 5 years, come off it. Why?
It's really old knowledge, that, isn't it?
Well, the good news is that we're talking about the fact that the one paper that set the cat amongst the pigeons like it did has now been debunked as being flawed science.
And is that why you were not going to go on it?
That's why I was not going to go on it. Yes. Yes. So when my sister
absolutely conditioned into us, and I'm like, I can get through this.
Yes. Yes.
This is the conversation I'm having with myself. I'm tough. I can get through this.
Beck,
sleep at night. Like, just because, as you know, when we spoke about it, when I did the run, I actually went into menopause. Must have been like it was. Well, it happened before because I had so much stress on my body.
Yeah.
So when I stopped my periods, and I haven't had a period since, and the night flushes, the not sleeping, the no libido, all the symptoms that you talked about, felt a bit like I couldn't focus on anything. Like you get you're just a bit all over the shop. It's like you're nearly having an out of body experience sometimes. Like it's just the weirdest thing. And for me, my mum's going, you need to go get HRT.
Really? Your mum?
Yeah. And I was like, no, I don't want to cause breast cancer. Like, do you know what I mean? And then when I spoke to you, you were like, oh, you need to get a little bit of something just to help you with your estrogen levels. And I was like, oh my God. So question for me is, when you do come into where you don't have your period, so for me, it's been quite a few years,
Mm.
do you still need hormone replacement therapy there?
Yes, Beck.
Yes.
Yes, Beck. Last Tuesday, I'm in clinic on Tuesdays. 2 Tuesdays ago, because this has been a week since you came in. 2 Tuesdays ago, a lady came in, typical, like, I know what estrogen deficient skin looks like. And if you Google estrogen deficient skin and go into images, you'll see it, right? The typical signs, the lines, the wrinkles, but there's a dryness and a dehydration to the skin where they have not been in treatment before. You know those skins
Yes.
very dry and fragile, lots of pigment. And she wanted some help with, she didn't know what, but just looking a bit fresher, she said. So I said, tell me about yourself. So as she's talking, I said, married, I said, are you on HRT? And she said, I am, but I don't really take it and I'm going to come off it. And I put my hand on her thigh and I said, please don't come off it. Let me tell you why. It might be that your dosage needs to be changed, but please don't come off it. And then I told her about the fact that the brain makes estrogen, progesterone, and testosterone. The brain needs it. The brain has a lot of receptors for estrogen. And the fact that we lose estrogen when we get to menopause means that cognitive function changes. It means that, like you said, you can't concentrate, you can't think, you're mincing your words, you've got a loss of words. How many times do I go, what was I going to say? Right? It becomes apparent. But you've got women, 10% of women globally leave the workforce every year because of unmanaged menopause symptoms. And these are women at the top of their game, Beck. They're not near ready for retirement, but menopause, because there's no support, is what has taken them out of these very competitive jobs that they have. But they're not leaving to go to another job or set up their own company. They're leaving saying, I give up, because they're made to feel like they're incompetent, they're dumb, they're stupid. Put her out to pasture. But it's not just the brain, the heart. Estrogen is cardioprotective. Estrogen protects the heart. And the thing is, because we haven't been taught about it, when my sister asked me whether I was going to go on HRT, and I said no, I'll just, manage it with exercise and lifestyle. I wasn't even thinking about that because I'm not someone who takes medication. I was diagnosed with Graves' disease 7 years ago, which is hyperthyroidism, and my eyes were bulging. I remember being in Barbados. My sister and I had gone to a friend's wedding, and we're going on this excursion, and my sister was buying tickets, and I'm just standing back waiting. I thought I was just standing back waiting. And then the cashier goes, stop staring, and just barks at me, right? Now I'm just over to the side, and she barks at me, stop staring. And I didn't know that my eyes were doing these ones, staring at her, right? And I was so embarrassed. I'm like, oh, I'm so sorry. I have a condition. And my sister still teases me. I have a condition, she says. But I didn't know that my eyes were staring. And I had dropped, I think it was easily 12 kilos. But I was frantic. I was like this. And I was going to the toilet. After every meal, I'd be in the toilet doing number twos after every meal without. And my hands were shaky. So when she arrives, my girlfriend had said to me, Chiza, I think you've got hyperthyroidism. And I'm like, oh, no. So my sister says, put your hands out. Shaking. She took my pulse, racing. I was severely Graves. So I was told to have my thyroid taken out. What I didn't realize was that menopausal women, there's an increase in thyroid dysfunction in menopause. Have your thyroid taken out? And I refused. I'm like, no, I'm not. Because if I have my thyroid taken out, autoimmune conditions are linked to gut health. 70% of your immune system is found in the gut lining. If I'd had my thyroid taken out, which my antibodies were attacking, so they were seeing it as being a foreign body inside of me, so they're attacking this organ. If they take it out, they have not solved the problem of autoimmunity. It will then my antibodies would attack something else. Now, I knew this. My sister was saying to me, you are highly irresponsible. And I'm like, it doesn't make sense to take it out, Necker. I'm not taking it out. Autoimmunity means that I need to sort out what's going on in my gut. I stopped drinking alcohol. I cut out grain. I cut out sugar. I've not drunken for 7 years. I went and did a blood test last week. Everything, Beck, I want to frame it. Everything is in everything. My doctor goes, Chiza, your antibodies are normal. All of my thyroid panel normal. Cardiovascular, my total cholesterol normal. Insulin, my blood sugar normal. HbA1c normal. Liver I was so proud of myself. And so people go, oh, but I can't do it. It depends on how desperate you are to get your health back. And the reason why I'm saying this is, usually if you have a thyroid issue, if it's hypo, they will give you thyroxine, which is a hormone. If you are type 2 diabetic, they will give you a hormone, insulin, to try and regulate things. We are estrogen deficient. Why are we not being told about topping up our hormones? And we're looking at estradiol. Estradiol is the hormone produced by the brain. It is the hormone produced by our ovaries. We're not asking for any other kind. We're asking for estradiol, which is now wild yam or soy. So when my sister told me all of these associated risks, I then started to do my research. And she says, I said to her, well, if anything, I'll go on bioidentical, I said. And she says to me, what does that mean? And I said, well, bioidentical hormones are natural. She goes, Chiza, HRT is now made from wild yam and soy, the same as bioidentical hormones are. The only difference is,
don't we?
The only difference is that you have all the clinical studies and the research. That one paper that we're talking about, they used conjugated estrogen that was synthetic and from pregnant horses' urine. But they also used synthetic progestogen. Now, the reason why I'm so passionate about getting the information out is what they found was that there was an increase in cardiovascular, in dementia, cardiovascular disease risk, breast cancer. And so they stopped the study. But what they didn't talk about was that they had a control arm, because it was a randomized control study. So there's always a control arm. And the control arm was estrogen only. And there was no increase of breast cancer in that arm. But what they left out was that in order to look at what the study was supposed to assess, which was cardiovascular disease in menopausal women, because up until that study was done, HRT was used as the first-line therapy for menopause, and it had been for forever. And menopausal women did fine on it. And then one day, some bright spark decided that they wanted to see what it did for cardiovascular disease risk. But in order to see that, you had to bring in people that were older, because it's only in the 60 and the 70-year-olds that the changes have started, right? Arteries harden without estrogen. And so, of course, in that older population, you're going to have that increased risk of disease. That's where the skew came from.
And do women take it for the rest of their lives?
Yes. So now your audience have got to look up an amazing doctor who is an oncologist, so a cancer doctor whose wife had breast cancer, who was on tamoxifen, and he saw what not having estrogen did to her body, especially vagina and mental health. He, after doing the research, he put her on estrogen. The book is called Estrogen Matters. It is New York Times bestseller. And his name is Dr. Avrum Bluming, Avrum And so now everyone's talking about the fact that this paper was flawed and that estrogen is not the problem. If estrogen was going to cause breast cancer, why in pregnancy, when estrogen levels go through the roof in pregnancy, why isn't there increased breast cancer? So it's about getting all of the information, and that's what I want to do. I want us to, so this lady who I said, please don't come off it, she said to me, wow, I had no idea. I had no idea that it was so important. Every mitochondria in every cell has receptors for estrogen. Estrogen is needed to get ATP pushed out to create energy. And this explains why women fall in a heap when they're menopausal. They have no energy.
And skin, if we want to, reflect back to that as well, because the treatment plans have to change.
Beck.
Yeah, it's
got to change.
And you have got an event coming up, and we need as many people to come to that.
Yes.
I'd love you to be able to share a little bit of that, because
yes,
lots of my clients, because it is their ideal client. And imagine being able to specialize
Mm.
in menopausal skin.
You will have them coming in droves. You will have them coming in droves. Listen, we're all on the same page. Doctors, nurses, therapists, we're all learning together. So this event is called Thriving Through Menopause. And it's actually quite a boutique event. I only have 200 tickets, right? So they're already doing well sales-wise. And I'll give you a little discount link for your community. It is designed to I've got amazing specialists. I've got the former president of the International Menopause Society speaking. Michelle Bridges is speaking because she has a menopause program. But I've got all of these experts coming to educate us. And what I want is for all of us to really see what opportunities there are for us. Treatment plan, how you can package programs. You might even want to maybe focus on specializing in this area. There is a chair, or there are 3 chairs on the market. One's the Tesla chair, the Emsella chair, and then Fatona do a chair that the menopausal woman sits on, and it sends energy up to the pelvic floor that strengthens it and stops urinary incontinence. When women say, "Oh, don't make me laugh, I'm going to wee myself," that is stress incontinence. When she says, "I can't jump on the trampoline, I'm going to wee myself," that's no, the other way around. Don't make me laugh, I'm going to wee myself is stress incontinence. Trampoline, stress incontinence. When she comes home and puts the key in the lock because she's busting and then she wees herself, urge incontinence. Both happen with estrogen decline. Beck, it is a misery. Women who are hiding away. One last one that I just have to say is in the vagina, we have the vaginal microbiome. Its food source is glycogen, which is found in the mucus. As it dries out, the microbiome disappears. And then anal bacteria, E. coli, come into the vagina. So menopausal women are known to have recurring UTIs that are antibiotic resistant. And what I'm trying to show with my excitement is that you can't have a menopausal woman walk through your doors and say, "Do you want a facial? Let's stick a lactic acid peel on you," without delving deeper into what's going on. Everybody's going to leave with a list of who they can refer their clients to, which is what I want, so that we can all support her collaboratively, because no one can do one thing, but collaboratively we can really help her.
Geez, everybody needs this. And I know even for myself, I've really been focused on food. So no sugar, no alcohol.
Good.
If I do alcohol, it's very rare.
It's more of a treat rather than every night.
Sleep, trying to get sleep. I still struggle with sleep. It's a huge thing. Like that's I think sometimes we drink too much coffee.
Stimulants, yeah.
So, I mean, there's so many. I think for me too is that women aren't living their best lives purely for this.
Can I just say one of the things, like you said, so it's diet, it's lifestyle. A component that's very important is self-care. Self-care, non-negotiable. You have got to be selfish about saying, "Do you know what? I need some time out." Whether it be that you go and have a massage, you get your nails done, you've got to fill your cup. The number of women, when I ask them what they do for themselves, they go, "Oh my gosh, I don't really. I'm so busy with my kids." And I'm like, you have got to carve out time for yourself, because when you pour love into yourself, you actually also come from a place of love. Most menopausal women are filled with rage. They're resentful, right? They're impatient.
It's victim mentality.
Yes.
For me, because that's what I feel, because
and no one understands them.
Giving to everybody. Like, oh, they're worn out.
And then the husband wants sex after that, and she's like, "Piss off."
Yeah.
You know?
Yes, that's another job I've got to do today.
It's a job.
Yeah. And losing that beautiful for sex with their husband, that's the connection. And so, yes, oh my gosh.
I've got a doctor speaking, and she says to me, she's coming from Perth to speak, Dr. Judy Craig, and she says, "Chiza, they sit on opposite sides of the couch." Now, she would love a back rub, but she knows it's going to lead to sex, right? But she was saying the connection is not there, because she doesn't want to go anywhere near him because he's going to ask for sex, but she doesn't want sex, right? So it's such a like the number of men that will say
effect.
To the kids, to everybody. Yeah, I say it's not just you going through menopause, your family is. Yeah. Your family is as well. Yeah. And so we have to talk about it. But then you have women who say to me, I'd rather stick pins in my eyes than talk to my husband about it. So, yeah.
Yeah, and how do we start the conversations? There's so much to learn here, isn't there? There really is.
Totally.
I've got to thank you because, you really go out on the limb. You find that I know when we did gut health, and that I dove into that like nothing else.
You did, yeah.
The absolute edge when it came to treating my skin. Like I literally, it was unbelievable. Now we've got this information. And it's so valuable, and we need to get this out to all the skin therapists and clinicians, all of them, to be able to really amp up how we're treating this perimenopause.
It makes sense though, doesn't it? It makes
100%.
sense.
It's making so much sense. Yeah. I've learned more today about menopause than I have in my 49 years of life.
Well, it was about it's about timing. When you're right, when you're ready, you're ready.
It's so beautiful that you're doing that. Because I think it's going to be an absolute game changer in the way that we treat skin, but how we look after women, like ultimately, and all of us are so passionate about helping women.
And we're all going to go through it. It's not going to miss anybody. It's not going to miss. So like you thought, okay, well, I'm, doing the exercise and I'm looking after myself. Your brain is still degrading. Yeah. Without you doing a thing. Your bones are still degrading. Yeah. The skin. Yeah.
I'm going to ring that number that you gave me straight away. As soon as I've picked up my phone going, you know what I mean? So, we're putting this out there. Anybody got any questions, please put it in the comments. Chiza is here. We all know Chiza is just a woman of complete service. When she gets her mindset on something, that's it. And that's it. She becomes obsessed because she can see the problem. And now all of us working together to try and find some kind of resolution and solution.
That's it.
For women to be able to live with something that we can't change.
Health span, to increase their health span, not just their lifespan. You don't want to be 90-year-old in a nursing home with broken bones, dementia, and recurring UTIs. You want to be 90 hiking, swimming, do whatever you want to do because you feel fantastic. Why shouldn't we? Look fantastic.
Oh, amazing, Chiza. I love you.
I love you more.
I love you so much. So I'm gonna say it now. Chiza's event, and hopefully there's going to be more of them. And hopefully, Chiza, I think if there's a way that you could maybe find some education for the clinic owners as well. Like
I'm actually working on it.
Yeah, beautiful.
I'm working on it.
So that course that you did for me with the gut health, it absolutely changed everything in our business. So I know there'll be something in the bag there for people.
Absolutely. We're working on it.
Tell us about this event and when is it?
So the event is in Sydney on the 24th of February, 2025. I gave myself a lot of time, so there were no excuses for anyone. You can start saving now. I've enabled Afterpay as well. So
you might need a bigger venue, I reckon.
Well, I'm going to have to turn people away. I can see it already because unfortunately it's only 200 and we're already nearly halfway. So but anyway, that's okay.
We need to talk about a little bit of virtual. Maybe you could do a virtual.
Well, I'm also looking at that. It will either be virtual or it will be post-event access. Yeah. But yes, definitely. So at the State Library, the iconic State Library, it is so beautiful. The venue is so beautiful. So Sydney State Library, 24th of Feb is when it is.
And it's for the salon?
It's for doctors, cosmetic physicians, nurse injectors, and skin specialists. And when I say that, if you treat skin, you cannot miss it. I have got the best of the best when it comes to menopause education. And I had to pull out the big guns because we deserve it.
Yeah, beautiful, Chiza. Oh, it's always an absolute honour to chat to you. As I said, if anybody has any questions, drop it in the comments. We'll make sure that Chiza gets it and she can get back to you on anything. If you've got a question, if there's a question about the event, Chiza's going to give us a link. Get in and book your tickets because this is going to be the thing that will absolutely take your skin business on treating those women from perimenopausal all the way through to the rest of their life. And we know that perimenopausal can start at what age?
Well, so up to 10 years before, right? So we say 40 onwards, but 1 in 100 women will actually become menopausal before 40. So 35,
You've got that peri then, haven't you?
So so peri is 10 years before, so usually 40. from 40, it can happen. But 1 in 100, it can happen before 40.
1 in 100.
1 in 100.
Wow.
So 35, women start to see change, right? And the thing about women is they will tell their friends about you once they find someone who really cares.
Yeah, beautiful. Chiza. Awesome. We're going to get the word out there. So
Thank you,
thank you so much for your knowledge. Love
Always a
chatting to
pleasure.
you.
Always
And
a pleasure.
we can't wait to be at your event.